Thank you all for joining us. My name is Erasma Veras Montecholo, and I am your host for Powering Up with Power of Two, in which we engage with community leaders, residents, and advocates to talk about the pressing issues affecting families and children in New York City and the steps that we can each take as individuals and as a collective to ensure the health and well-being of our communities. A couple of reminders before we begin. We will make this video accessible in Spanish, and closed captioning is available for those differently abled. We also encourage you to please share your questions with us in the chat. As you all know, at Power of Two, we partner with families to help them tap into responsive parenting as a way to heal from intergenerational trauma, to create healthier trajectories for their children, build on our community's foundation of resilience, and harness the collective power of community to dismantle the systems of oppression. A study in 2019 by the National Academies of Sciences and Engineering and Medicine showed that poverty itself, whether for short stints or prolonged periods, could cause lasting harm, leaving children with less education, lower adult earnings, and adult health. However, the panel also found that income subsidies have been shown to improve child well-being. We at Power of Two are deeply encouraged that our elected officials have taken historic measures in addressing poverty by prioritizing the needs of families and children through the American Rescue Plan Act. According to the New York Times, the child benefit provisions have the makings of a policy revolution. Today, we are excited to welcome Raysa S. Rodriguez, Associate Executive Director for Policy and Advocacy at the Citizens Committee for Children of New York. And she will talk with us about the historic American Rescue Plan Act, how it impacts our communities, as well as the ways that we can work to ensure that our leaders continue to be accountable to our concerns and needs. Thank you, Raysa, so much for joining us today.
Thank you. Thank you so much for having me. Happy Friday. I'm so looking forward to our discussion.
Indeed. Thank you so much. So, the American feminist Carol Hanisch was credited with saying that probably about back in the 1970s, that the personal is political. Can you share with our audience what brought you to this work?
That's such a perfect quote to start with. Indeed, what brings me to the work is really a deep personal connection to so many of these issues. I think that's exactly right. The personal is the political. I think especially today, there's no way not to be engaged and involved in the necessary fight when they hit so close to home. And so for me, my long work in advocacy and in fighting for children and families broadly has really been tied to personal experiences, to a deep connection to my community. Proud to say, born and raised in the Boogie Down Bronx, the first in my generation to attend college. Education has always been that mantra, right? Of the dream to kind of succeed. And so very much shaped by my upbringing and my background, and in a relentless belief that all children should be able to achieve their dreams.
That's wonderful, Raysa. Thank you so much. So here we have BX represented, and you have Brooklyn represented. So here we go, two Brooklyn and Bronx girls. So Raysa, let's get right into talking about the American Rescue Plan Act. According to estimates from the Urban Institute, as well as some information that we gathered from CNN, they stated that one of the most consequential provisions is the expansion of the child tax credit, which will be in effect this year. So the enhanced portion of the credit will be available for single parents with an annual income of $75,000 and joint filers making approximately $150,000 a year. Families will receive a credit of about $3,600 for each child under 6 and $3,000 for each one under age 18, up from the current credit of up to $2,000 per child under age 17. Can you tell us how all of this, plays out in real terms for low-income families?
Absolutely. I think we're right on point to start off with this important provision. In my view, it is one of the most significant provisions of the American Rescue Plan. Simply put, it means less hardship. Families with children and with low income will have more money on hand to cover expenses. And as parents, we know what those expenses are, right? It's nutrition, it's educational supports, it's all the things that we know allow for healthy child development. It's been well documented that what families need, families who are facing economic insecurity need most, is cash on hand, period. And so, this provision that allows us to expand what we know are effective tools in the fight against child poverty is very promising. I'm so glad you started with, the well documented impact of poverty on kids. We know so much already about the long-term impact that poverty can have on child development during critical years of development, whether it's health, social, emotional well-being, whether it's education, right? But more importantly, any experience with poverty can have lasting detriments into adulthood. And what we also know is that poverty was a significant issue even before COVID, right? Right now, given the context of things, what we're all trying to recover from, we're really laser focused on what recovery requires. But when it comes to child poverty, we already knew we had a huge problem on our hands even before the pandemic. 1 out of every 3 counties in New York State had child poverty rates well above the statewide average. And we know that more than 800,000 children across the state were living in poverty. And this is despite many, families with caregivers and parents engaged in the labor market and working, right? So we know that child poverty has been an issue. And we also know that during the pandemic, those numbers have only gotten worse.
No, that's absolutely right. Sorry, go ahead, continue.
I was just going to add that the potential for this moment, right? When you think globally, right, we've been behind countries, comparable countries of size and wealth. We've been behind in the implementation of what are proven policies to cut and prevent child poverty. This provision really puts us in the right direction, finally, right, to begin to get some traction there. I often say that I'm optimistically hopeful, and we'll get to why, because it's not a perfect plan, but it is definitely a great sign of hope and an important step in our fight to end child poverty.
Yeah, no, thank you, Raysa. As part of our work at Power of Two, we focus, as I mentioned earlier, on the intergenerational healing of trauma. But, not a lot of people know where the trauma stems from, right? A lot of people think, oh, it's just, personal responsibility. You made bad decisions. But can we talk about the choices and the options that we have? And usually when you live in historically marginalized communities where you're exposed to continuous adverse experiences, right, which in turn turns into toxic stress, it affects you. It affects you physically, mentally, intellectually, and that gets passed down, throughout generations. So the fact that our administration has prioritized children and families in this way is something that, similar to you, gives us a lot of hope. But there's definitely a lot more work that needs to be done. A follow-up to that is, how many fewer people will be living in poverty as a result of this relief package?
Sure. So, it's still early to tell. And one of the things that we'll get to is that many of the effective tools that are in place are for this year, right? We need to work to make them permanent. But there are, estimates that this bill has, and the child tax credit in particular, has the potential of cutting child poverty by nearly half, right? So it has an incredible potential. We need to do more, but it is definitely an important step in the right direction.
And obviously, there was another relief plan that was in place with the prior administration. How does this one differ? In addition to this prioritizing of poverty, how does this one differ from previous relief bills?
Sure. I mean, just in size, the magnitude of the package is historic. There's also, in addition to prioritizing children and families with a number of things, yes, the child tax credit, yes, the expanded earned income tax credit that's also likely to reduce poverty for a lot of New Yorkers. Yes, to the, stimulus checks that are available to individuals and all children in the household. The extension of enhanced unemployment insurance is important, But in addition to that, it allows critical resources for the things that we know children and families and communities need for well-being. So it expands health coverage. It provides critical funding to schools so that schools can begin to open up safely, so that we can prioritize learning loss. We can talk a whole hour about all the concerns that we have related to the inequitable access to remote learning and what that means to children, who are Black and brown and in some of the hardest hit communities. The bill provides critical funding to schools, and for cities and states to be able to mitigate some of those loss. It provides critical funding to childcare, right? An important vehicle for economic recovery. Families cannot get back to work in a sustainable way without having a strong childcare workforce to rely on. And so the funding also provides for that, and so much more.
Yeah, I have some questions related to what that looks like on the ground. But before we get there, I wanted to spend some time, talking with you about, the fact that these supports are temporary. How long are they actually expected to last, first of all?
Well, it depends. Again, this is a monster of a bill, if you will. And so it depends on the particular item. So there are expansions, for instance, in the health area where benefits are being expanded. Those will spread over several years. Some of the local aid to cities and states will also extend beyond a year. When we talk about the benefits that are reaching households and families directly, a lot of those are 1 year limited, right? So the child care tax credit, the expansion in earned income tax credit, that's for 1 year. The stimulus funds are also one time for this year. And so we need to do more. We know, again, in what's available in terms of evidence, in terms of what's most effective at reducing poverty, this bill includes some of the most effective tools, tax tools, right? Those that I've already mentioned, they need to be permanent. We need to do work. CCC has long advocated to really expand these type of protections to cut child's poverty. And we need to be able to kind of develop and build on the pressure that's going to be necessary to make sure that these are permanent fixes.
Yeah. So, when thinking about that, right, what do you see as the possibility? What do you see as the compelling argument? Obviously, poverty reduction, actually not even poverty reduction. Let's be real. We want to eradicate poverty, right?
Right.
What are the signs that you're seeing in Congress right now that are making you hopeful that there is a desire to make some of these things actually permanent?
Yeah. I mean, I've seen firsthand some of these conversations already take place, right? There's new blood, if you will, that I think come with really great energy. Richie Torres in particular is doing a great job from the Bronx. Again, that wasn't an intentional plug, but he's doing so much, right? And leaders like him are doing so much to, yes, take this moment to celebrate, right? Because it is a historic moment, but also calling attention to the long-term needs in terms of making this permanent, right? As part of our social safety net.
And so there's work that our local leaders, right, at the city level, at the state level, that I'm assuming they're doing in partnership to try to compel Congress to make some of these supports permanent. But what are the tangible ways that us as individuals and as community can really hold our elected officials accountable so that these benefits can actually be long-term?
Yeah, it's a great question. It is definitely what fuels our work at CCC day in and day out. I think the first step is really just being informed around what is important in the community, what affects well-being and at the community level, getting involved and staying involved, right? When emerging needs are made available and present. And so I think it takes at an individual level just a commitment to being informed, to getting involved, and then to build pressure and make noise and fight for change. Unfortunately, we are, all products of a system where advocacy is necessary, right? We do. It's what keeps me up at night. The fact that we have to even fight against cuts, right?
Mhm.
For children programs in the budget. Shouldn't be. That should not be the system that we have in place, right? We should, as a whole, see the collective value of ensuring that all children are well taken care of, right? And we should have systems in place that are accountable towards that. But the reality is that in order for change to take place, we've seen history teach us, present teaches us as well. What's necessary is voices, and a lot of them, right?
Mhm.
And pressure. At the end of the day, elected officials are individuals who are accountable to the voices, at the community level. And so the more the community can, equip themselves with information, and with, tactical strategies to be engaged, the more they have to respond to that call.
Yeah. One of the things, thank you, Risa. One of the things that I hear very often from, our families is that they don't have access to that information, right? Where does this information live? Where do I go to be, to get informed, be informed, and be activated? And so what is your response to that?
It's such a great question. I think this is an area where I'm really hopeful. I'm inspired and encouraged by organizations like Power of Two, right, who are providing these type of information. I'm empowered by the work of CCC that actively engages in educating, right, New Yorkers who want to know more. And so there are avenues at the community level to get more information. I'm also inspired by our youth, right? We are, I would say, living through a moment where more and more youth are actively engaged, right? I see it at home. I see it at the community level. I see it in government itself. And I think the more traction we make at those levels, the more we'll be able to increase access to information. And I would also add it takes, building demand for it. So if it's not available, are we going to just sit back and just, while the information is not available, we have to build the demand for that access to that information. And so there's always a way, I would say, even if you can't find, the information that you're looking for, there's always a way to kind of figure out what avenues to, knock on someone's door.
I mean, one thing that I can say about this is that, during the height of COVID, the height of the pandemic, in some communities we're still at the height of it, right? But early on in 2020, when a lot of businesses shut down and a lot of our homegrown organizations were still on the ground working, it was beautiful to see everyone coming together and coordinating resources to make sure that we were able to support families, but also to provide information. And I think that's something that we must continue to commit to, that we must continue to organize at different levels so that we can make information and materials accessible to folks, right? So that they can make with their own self-agency determination, make decisions about how they wish to get involved and who they want to vote for. Because, as there are elections coming up, folks. So this is the time that if you really want to create substantive change, use your power to vote.
Yeah, and there's no short list of need, right? There's just so much need. There's always something in some area to get involved in, I would say. You asked in terms of like what folks can do. Again, at CCC, we work to ensure all New York children are healthy, housed, educated, and safe. And so we cover a wide array of issues, where if that's an area that your viewers are passionate about, they can definitely plug in to learn more. Just to give you some examples, in the area of health and behavioral health, we're working at a policy level to ensure that we pass legislation for greater access to behavioral health services. I'm so glad you talked about trauma, right? Everyone's talking about trauma. We're not talking enough about what it takes to actually develop a network, a system where kids have what they need to get the support that they deserve. And particularly now, this last year has been so traumatic for all of us, right? And so we want to make sure that those services are in place. In education, making sure that families have access to high quality childcare. In education, ensuring that there's equitable school funding, right? We want to make sure all kids have a fair shot, and that means all schools should be funded with the appropriate level of resources to ensure they could provide high quality education. And
right.
then housing, we can talk so much. There's so many issues that we can talk about, right? But housing, another important piece of the plan. It includes $1 billion for New York for rent assistance. We know that housing stability is important for children, and when kids experience homelessness, it has a impact on their development, right? And so we've long fought for statewide subsidy.
Yeah, all of those things to me are really important, but I also think that it's critical for community to be involved in those conversations, right? So not just, policymakers and decision makers deciding what types of programming, communities should receive, but actually the community themselves are really, really well versed in their own needs and should be the ones leading the charge about what kind of solutions they really want to see. Right?
Absolutely. I mean, they are the experts, right?
That's right.
Mean, they are, they know not only what they're experiencing, but what the solutions would be to the problems that they're facing. And you're absolutely right. We continue to find ways to elevate the voices of those who are most impacted through our work with community groups, through work with individuals with lived experiences who have, firsthand experiences, whether it's, in shelter experience or other areas. And again, making sure that we elevate those voices.
Yeah.
Your ambassadors are also the perfect model. So I have the great privilege of joining you this afternoon on the heels of spending an evening with your ambassadors last night. And that is at the core exactly what you're describing. They know the right questions to ask, and they definitely know what the solutions are that we should be driving.
Yeah, no, thank you. They're wonderful. So folks that don't know, in addition to providing ABC to our families, we've also created a community ambassador program that allows our program graduates an opportunity to engage in the important conversations about the issues that affect them and the solutions that they themselves can create to solve those particular issues. And the CCC is one of our partners, and we're truly excited that we're doing this together. So thank you so much. I want to take a couple of questions from the audience. One of those questions is from Carlos Rosales. His question is, excuse my glasses again. What should we and families expect after this stimulus? I am worried that this might be, and I know people personally who need a lot of help because they are behind in rent, bills, and other needs for months. I know that they're grateful for this help, but I also see so much of their debt, what they and we owe, rising.
Yeah. That's a great question. Thank you, Carlos. It's one of the things that we've been highlighting in terms of stop solutions that are necessary. So right now there's an eviction moratorium in place, and that has prevented a surge in family homelessness, as an example. When that's lifted, we know that not only are subsidies going to be required, but we need both short-term and long-term rent assistance so that rent that's been accrued is covered, but as well as rent that's ahead in the long term. Because what we know, if we learn from other historical moments of economic downturn, right, recovery is a long road, and so we have to make sure that the appropriate solutions are in place, and that again comes back to making sure we make not only the right calls from a policy standpoint, but continue to make folks accountable on making significant changes. I also think there's work to be done, again, to make some of these benefits permanent. Beyond that 1 year is also going to be critical.
Yeah. Raysa, one other question that we received in advance from community members relates to how much a family could actually receive from the new package. Can you shed some light on that?
So it depends on the family size. I think that it's a couple of different scenarios. So, a family of 4 with the stimulus check and the rebate at hand, can receive a one-time over 5,000. In addition to that, depending on the kids' ages, right, we're looking at an additional 3,600 refundable for children younger than 5, or 3,000 for above. And so I would say that it depends on family size, the ages of the children, and other demographics.
Okay. No, thank you. And who do they go to for information to figure all those things out?
Definitely not me. This is a funny
Should they
question.
call the IRS?
Exactly. I get this question a lot, and there's still so much that we're learning about the bill and what it's going to take to actually get these incredible so much money out the door, right, and effectively spent. In terms on the ground level, what folks can do, definitely contact IRS if they're seeing any delays. I would also just encourage folks to be plugged into their community partners for questions. I think, from a housing standpoint, Home Base is always a great resource to at least, again, just get information on what's available and what steps folks can take.
Right. Okay. So now let's talk a little bit about, the shift. We were talking about kind of like the national kind of decisions. And then what does that mean here, like on the ground in New York State? So, obviously we've been contending with a deficit, a $15 billion deficit, if my memory serves me right. How much of the stimulus will New York State receive?
Sure. So we're getting a significant amount of resources. New York gets $23.8 billion. It's a huge amount, right? I think about 6.1 goes to New York City specifically. And of those resources, there's like an itemized list, right? So there's like $9 billion for schools. There's money associated to college and universities. There's resources to expanding health coverage. There's also resources for infrastructure, right? For transportation and for small businesses. But a total amount is about roughly 24 billion to New York State.
Okay. So,
and that sounds really significant. What we are, at the core right now trying to do is holding, as you say, government accountable. We are in the process of finalizing a budget at the state level. And one of our charges is making sure that we not only leverage this moment of historic investment, but make sure that, the deficit, as you mentioned, is not closed on the backs of children and families. So yes, we're getting resources. How do we make sure that is in addition to what should be the state government's responsibility across all issue areas? So there are a number of things that I can highlight. Our fight for child welfare prevention programming, for instance, is something that we are really keeping an eye on. During these difficult times, we know that families have leaned on preventive services providers as a key resource to provide a whole range of benefits, right? This is the time to invest more in these type of services, not the time to cut back.
No, absolutely. One of the things that obviously we've been, keeping an eye on is obviously the state budget, right? And I know that in January, the governor stated that the state would potentially have to cut about $2 billion in school funding, $600 million in Medicaid funding, and $900 million in other across the board reductions, which also includes, prevention. Is the governor still expecting to do this, or does he have some flexibility to make budget adjustments this year?
So he does, with this new resources coming, he does have the resources and the flexibility. And that's one of the things that we're building pressure for, right? I think we have 2 weeks for a final budget. So I'm not ready to make any predictions, but we're working hard to make sure that services for children and families are fully funded.
Okay, so now that makes me happy to hear that he has the flexibility and the advocacy continues over in. I'm certainly sure that is in earnest, right? To make sure that all of the needed resources are allocated to families and children in New York. I have a couple of more questions from the audience. One specifically, some folks want to know about housing. So if we can spend a little bit more time just talking about the specific allocations that the bill has made to help people with housing. Can you talk a little bit about that?
Sure. So as I mentioned, there's about $1 billion coming to New York for emergency rental assistance. And right now, what's being created is an avenue for getting those resources out the door. We've been advancing recommendations collectively developed by stakeholders like CCC, other advocates as well, looking for ways to remove barriers for this type of funding, right? So oftentimes when there's an these level of resources, what we see is, just restrictions on how the money can be spent. We want to make sure these dollars are as flexible as possible and we can get them out the door. So looking at requirements like having to demonstrate an eviction proceeding, right? We know that doesn't make sense. That is exactly what we're trying to avoid, right? We don't want to see families having to be in an actual eviction proceeding to make sure that they get rent assistance. So removing those type of barriers, also expanding the eligibility criteria to make sure more families are covered, including families with mixed status.
When you say families with mixed status, can you explain that a little bit?
Sure. So families with mixed immigration status, so either undocumented or having some sort of combination with, undocumented and documented or citizens.
Okay, great, thank you. And what can you tell us about the provisions for healthcare?
Sure. So one thing that I'm actually really excited to see. There's been an expansion of benefits for postpartum benefits. They extend coverage to new mothers for 12 months. And this is one of the benefits that are here for the long term, right? So beyond the 1 year, I think this is an important area to highlight, given what we know in terms of disparate outcomes for Black mothers who are new mothers and infant and child mortality rates. I think this can be an important benefit to make some improvements in that area. It also allows for more Medicaid coverage. It gives more resources to states to cover some Medicaid expenses. Again, allowing more flexibility for the state to cover more expenses. We know things have been more costly given the pandemic. This bill allows for some of that. It covers, costs for vaccines, for COVID-19 vaccinations, and also has other provisions like allowing for or covering the cost of insurance when one is unemployed.
No, those are wonderful. And, obviously one of the things that we have been as a city struggling with is the distribution of vaccines, right? Of accessibility. Is there a lot or a little bit of provisions in the bill to address this, the inequitable distribution of vaccines across, the nation?
Yeah, I'm not entirely versed in that. I know that there have been efforts to make sure we ramp up, right, the vaccines. And so I think some of that has made a difference in ensuring that communities that have been hardest hit have access to vaccine. It's something that we're going to have to keep monitoring in the long term. Okay.
And I have a few more questions, but I want to make sure that audience has an opportunity to share some of their own. From Carly, can Raysa explain more about the 12-month postpartum benefit? What does that look like?
Sure. I know it's going to be available for up to 7 years. And it has, states have to have the option to apply for both Medicaid and for CHIP programs. And it just allows for greater access for individuals. I can get more particulars on what else is included in that provision, but I don't have them on me.
Okay. One of the things, and I know that the CCC also has been paying close attention to, is, Medicaid, right? And, obviously expansion of Medicaid, making that more accessible, but also, a lot of home visiting programs have been paying attention to potential allocations to allowing home visiting to fall under Medicaid provisions so that we can make it more accessible to more families. Is there any way, or are you seeing that in any way we would be able to kind of, through these new allocations, be able to be part of that?
Yeah, I mean, I have, this makes me think of my colleague, Alice Buffkin, who I'll plug her here. She is our go-to expert on all health issues. And she would definitely have something to say. What I can say is if folks get involved, stay involved with CCC, that's exactly the type of information that we can provide in terms of ways to get engaged. I know for sure, Medicaid funding and ensuring equity, even to kids who are covered through CHIP program as well, has been a core focus of ours.
Thank you, Raysa. Can you tell us a little bit more about the work that the CCC is doing here at the local level, at the community level? How are you partnering with different organizations in this space?
A lot of different ways. So, we find strength in numbers. And so I think coalitions is an important vehicle for our work. We are a lead organization in the Family Homelessness Coalition, aiming to solve family homelessness by preventing shelter entry, improving conditions when shelter is unavoidable, and expanding affordable housing options. We are a lead organization in the Raise the Age Coalition, really looking for ways to really build out more equity in the youth justice system. There's so much work to do to make sure that there are investments at the community level for resources and services that we know are known to reduce youth justice involvement and to promote community safety. Our work with, the Campaign for Children in ensuring that young children have high quality early childhood education, as well as access to universal summer programming. There's so much talks right now about what the summer is going to look like. How is the summer going to be different than last summer, right? And an incredible focus on ensuring that the summer is a important bridge to mitigate some of the learning loss. After the state budget, we'll be turning to the city budget and ensuring that federal resources are, leveraged to make sure that the full range of services that communities need are available. Working with the city council to make sure their council initiatives for community-based behavioral health services, as an example, are covered, and ensuring that, there is that accountability.
Thank you. We have another question from Carlos. What should immigrant families know about upcoming benefits, especially if there is a family member or parent who is undocumented? There was a lot of fear and concern about trying to access benefits last year or worry about qualifying for benefits.
Yeah. I would say, speak to their local community partners. There are some benefits that, as I mentioned, that are available, even if a child doesn't have a social security number, or, benefits that are available if the parent doesn't have a social security number. So it depends on the particular benefit, and just getting that right information.
Yeah, Carlos, I would also recommend that folks contact the Office of Community Affairs because they have an Office of Financial Empowerment, which does a lot of work with community organizations around this time specifically, related to the tax season. And they'll be able to answer lots of questions about, filing for the child tax credit, EITC, et cetera, and may be able to also provide additional information about, potential benefits to immigrant families. So thank you for that. Raysa, as we're soon to come to the conclusion of our conversation, I really want to talk with you about, from your perspective, what do you see as the most significant part of this bill, and we talked a little bit about this already. And what would you like to see collectively from our communities to really leverage the power of this moment to ensure that there's equity and continued progress going forward?
Yeah. Thank you again for your time for, allow my voice in this discussion. Definitely for me, what I think is the biggest, most significant piece of this is the child tax credit and what that could do in the long term at finally getting us on the right track to reducing child's poverty. I think it is we've done in our historical kind of overview. We know what works to reduce poverty. We've done it in the universe of seniors, right, and reducing poverty among seniors. This is an opportunity to do that, exactly that, for children, and making that benefit permanent would be an incredible win.
Thank you. I know that we as an organization are looking forward to continuing our partnership with the CCC to make sure that we can advocate for those extended benefits and supports for our families and children. So thank you so much, Raysa, for that. Thank you all so much for watching and listening today. When I think about our conversation today, when I think about all of the work that we've been doing, I always think about Nelson Mandela and the speech that he gave back in 2005, I believe, entitled "Making Poverty History." And, there were several things. There's so many quotes that I have from that. But there's one particular one that really sticks with me, and that is that overcoming poverty is not a gesture of charity. It is the protection of a fundamental human right, the right to dignity and a decent life, right? And so I say this because this is our moment. This is our moment to eradicate poverty. This is our moment to ensure that every single person in our nation has the right to dignity and the opportunity to live a full and decent and healthy life and be able to accomplish whatever their hearts desire. So Raysa, thank you so much for joining us today. Thank you for the amazing work that you and the team of the CCC do every day for families and children. To all of you listening, please get involved. Use your voice by being part of the CCC, by reaching out to us at Power of Two, and by just learning and asking questions. Your voice is definitely needed. Everyone, please stay healthy and stay safe, and we'll visit again soon. Take care, everyone.
Thank you so much.
Thank you.